Good afternoon. Today we are going to discuss regarding a new topic, which is meningitis. From the word itself, it's clear that it's an inflammation of the meninges. So what is meninges? It's a membrane that covering the skull and the brain. You can see in detail. Although the meningitis is a notifiable disease, the exact incidence rate is unknown. And in 2010, there is 4,20,000 deaths, and in 2013, there is 3,03,000 deaths in the worldwide. And it can occur as a complication of other diseases, and 50% is an opportunistic infection. So it's a mainly it's a notifiable disease, and its incidence is more. Of newborns, 20 to 30% may die from bacterial meningitis, and this risk is lower in older children, and it rises again in the adulthood. And in the adult, 66% of all cases emerge without disability. The main problem are deafness and cognitive impairment, as is a complication of the meningitis. So it's a meninges. The meninges are the layers of tissue that separate the skull and the brain. So in this picture you can see that this is the skull and this is the brain part, and in between that there is three layers, that is a dura mater, arachnoid matter and the pia mater. These three layers of membrane is known as the meninges. And coming to the definition, the meningitis from Greek word menings, which means membrane, is an acute inflammation of the meninges, and it is mainly caused by either bacteria or virus. Meningitis is the acute inflammation of the meninges. That's the definition of meningitis. Then coming to the route of entry in CNS. Mainly the route of entry in CNS is through the skull or backbone fractures, that is because of trauma, and the medical procedures along peripheral nerves and blood or lymphatic system. The infective organism may enter into the CNS through skull or backbone fractures, then medical procedures like the craniotomy and all, then along the peripheral nerves and the blood or lymphatic system. Once there is a infection in the blood, that may spread along to the entire body, and which may lead to the meningitis. Then coming to the etiology, the causes can be classified into bacterial infections, then viral infection, fungal infections, then inflammatory diseases like SLE, then cancer, trauma to head or spine. These are the different etiological factors. The causes can be classified into bacterial infections, viral infections, then fungal infections, inflammatory diseases, cancer, and trauma to head of spine. These are the main etiological things regarding to the meningitis. Then coming to the pathophysiology, as you already discussed that it's mainly due to the bacterial in origin, and once the bacteria enters the bloodstream or through the trauma, that enters the mucosal surface of the cavity. Once there is a bacteria in the bloodstream or because of trauma, then the bacteria will enters into the mucosal surface or the cavity, and which will in turn enter into the breakdown of the normal barriers. Means once the organism enters into the mucosal surface, there will be breakdown of the normal barriers and crosses the blood-brain barrier. Once there is a breakdown of the normal barrier, that means that will cross the blood-brain barrier and it proliferate into the CSF. Means the cerebrospinal fluid will be filled up of the bacteria, and that will lead to the inflammation of the meninges, and in turn once there is inflammation of the meninges, that will lead to the increasing in the ICP. This is the pathophysiology of the meningitis. Once there is a bacteria enters the bloodstream or trauma, then the enters the mucosal surface or cavity, and once it enters into the mucosal surface, then the breakdown of the normal barrier will be there, and that will lead to the that will result in the organism will cross the blood-brain barrier, and that proliferate into the CSF, and then inflammation of the meninges, and in turn that will be resulting in increase in the ICP. Hope it's clear. Then we can see one by one. That is one is bacterial meningitis. It's also known as the septic meningitis, and extremely serious that requires an immediate care and can lead to permanent damage of the brain or disability and even death. And it is spread by the coughing or sneezing. So it's the main things regarding the bacterial meningitis. It's otherwise known as the septic meningitis, and it is extremely serious that requires an immediate care and which can lead to permanent damage of the brain or disability and even death. And it is spread by the coughing or the sneezing. And its treatment available is once there is a bacterial infection, we will be using the antibiotics as per the causative organism. Whichever the organism is the, depending upon the organism, we will be using the specific antibiotic to reduce the infection and inflammation. Then the main causative agents are Streptococcus pneumonia, that is 30 to 80%, the Neisseria meningitis, that is 15 to 40%, and the Haemophilus influenza, that is 2 to 7%. These are the main causative organism which will be resulting in the bacterial meningitis: Streptococcus pneumoniae, Neisseria meningitis, and the Haemophilus influenza. Then coming to the tubercular meningitis. From the term itself, that's clear that there is a tubercular or the TB meningitis. It is mainly caused by the organism Mycobacterium tuberculosis, and infection with this bacterium begins usually in the lungs. Means once there is a TB, then that is a infection which resulting in the damage of the lung tissues and all. And once there is an infection in the or the Mycobacterium tuberculosis in body, and which will result in the pulmonary tuberculosis, that will be resulting in the or the infection will be spreading to the brain, and that will be resulting in the tubercular meningitis. And 1 to 2% of the cases, the bacteria travel via the bloodstream, and unlike other types of meningitis, its progresses very slowly and symptoms are vague. Means the tubercular meningitis will be progressing very slowly, and we cannot detect it earlier, and the diagnosis will be delayed, and it may lead to the serious complications. The pathogenesis of the tubercular meningitis. Once there is a droplet infection, that will be the bacteremia will be there, and the bacteremia will be resulting in the meninges and brain parenchyma will be getting infected, and that will be the rich focus, and which will result in the rupture into the subarachnoid space. Once this rupture into the subarachnoid space, there will be adhesions, vasculitis, and the encephalitis. Once there is a adhesion, there will be basal cisterns, and the hydrocephalus will be resulting, and the interpendicular fossa will be getting affected, and there will be cranial nerve palsies, and internal carotid artery stenosis will be there. Then in case of vasculitis, there will be stroke, especially the basal ganglionic stroke, and the internal carotid proximal middle cerebral artery means there will be stroke, especially in the basal ganglia, then internal carotid, proximal middle, and the cerebral arteries and all. Then the encephalitis, that is once there is an encephalitis, that will be resulting in the cerebral edema and increasing in the ICP. This is the etiopathogenesis of the and the main things what happening in case of a tubercular meningitis. Then coming to the viral meningitis. It's also known as the aseptic meningitis, and is more common than bacterial form, and usually it's less serious and less likely to have the permanent brain damage after the infection resolves. And the treatment, no specific treatment available for the viral meningitis, and the most patients recover completely on their own. Means the symptoms will be getting relieved progressively. That's the thing what happening in this case of the viral meningitis. The causative agents are enterovirus, then adenovirus, arbovirus, measles virus, herpes simplex virus, and the varicella virus. These are the common organisms which will be resulting in the viral meningitis. Then coming to the fungal meningitis. It is much less common than the other two infections, and it is rare in healthy people, but it is more likely in persons who have impaired immune system. So it's a much less common than the other two infections, and means the less than bacterial and viral infections, and it is rare in healthy people, but it is more likely in persons who have impaired immune system, especially those who have the children's and the immunocompromised patients, or those who have the cancers, or other persons who are taking the continuous medicine for and those who are had in the liver transplant surgeries and all. Those are the patients who are at high risk for poor immune system, and in these cases there will be opportunistic infection, and which will be resulting in the fungal meningitis. Then coming to the risk factors, that is the systemic infections, then viral RTIs, that is respiratory tract infections, then the tobacco use, then impaired immune system, especially the cancer patients, and all the other things, but and then the overcrowding. These are the main risk factors for the fungal meningitis. Then the vaccinations and the seasonal. The seasonal means winter and spring season, and the seasonal variations will be bringing the persons to immunocompromised, and that may be resulting in the opportunistic infections, and which may be it may be a mild case, or it may be a severe case. Then coming to the clinical manifestations. Mainly the clinical manifestation can be seen in the infants and the adults separately. In infants, there will be fever, possibly with the cold hands and feet, then refusal to feed or vomiters, then high-pitched moaning or cry or whimpering will be there, and dislike of being handled or fretful, then neck retraction with the arcing of back, then blank and staring expressions, then child is difficult to wake, and the child will be lethargic, and there will be pale and blotchy complexion will be there. These are the main clinical features shown in the infants. Then coming to the adult or children, there will be stiff neck, then headache, fever, vomiting, then light sensitivity, then drowsiness or confusion, then joint pain and fitting. These are the common symptoms in the adult. Stiff neck, then headache, fever, vomiting, light sensitivity, drowsiness or confusion, joint pain and the fitting. Then coming to the two main signs, that is the Kerning signs and the Brudzinski sign. First we will see the what is Kerning sign. That is a severe stiffness of the hamstring causes an inability to straighten the leg when the hip is flexed to 90 degrees. There will be inability to flex the knee because of the stiffness of the hamstring muscles. As shown in the picture, there will be, once we are holding the leg in this position and we are trying to bend the flex flex means there will be very tight feeling, or the stiffness will be resulting in poor ability to flex the knees. That is the Kerning sign. This will be positive in case of a meningitis patient. The next one is the Brudzinski sign. That is, once we are examining the patient in the lying position, there will be severe neck stiffness causes a patient's hip and knees to flex when the neck is flexed. Means because of the severe neck stiffness, there will be a reaction which will be resulting in hip and knees to flex when the neck is flexed. As shown in the picture, once the patient is lying and we are flexing the neck, means automatically the flexion of the knee and the hip will be happening. That is a positive Brudzinski sign. Then coming to the assessment and diagnosis, mainly the history taking, then physical examination, then CT and MRI examination, then blood culture and sensitivity, through which we can identify the particular organism which is resulting in the infection. Then lumbar puncture, in that we can analyze the CSF, and according to that we can identify which type of meningitis is this. Means according to the bacterial or viral origin, there will be differences in the CSF analysis and the report will be differing. These are the main CSF findings in case of a bacterial, viral and fungal or the tubercular meningitis. The pressure will be 5 to 20 in normal case, and in bacterial there will be more than 30. Then viral, it's normal or mildly increased. So, and